What is ADHD? Understanding Attention Deficit Hyperactivity Disorder. The CDC reports that 11% of children and teens in the US have been diagnosed with ADHD. Did you know that adults can also be impacted by this neurodevelopmental disorder? Hi, I'm Melissa Hummelt, LPCC, a therapist at BetterHelp. In this video, I'm going to answer all your questions about this common disorder, including questions about what exactly is ADHD, what causes ADHD, how is ADHD diagnosed, what are treatment options, and more. What is ADHD? Let's start by talking about what ADHD is exactly. ADHD stands for Attention Deficit Hyperactivity Disorder. It is a neurodevelopmental disorder, meaning the brain develops differently in people with ADHD. These differences in brain development affect how the brain directs attention. In some people, they can also cause hyperactivity and impulsivity. Many individuals with ADHD start to experience symptoms in early childhood, right around the time they start elementary school. This onset can vary, though. Some people don't notice ADHD symptoms until they're 11 or 12, for example. Adults can also be diagnosed with ADHD, but this just means their symptoms weren't addressed during childhood. ADHD always emerges before the preteen years. What causes ADHD? So what causes a person's brain to develop this way? In other words, what causes ADHD? The answer is we don't really know. Research is still underway to find out what the exact cause or causes of ADHD are, but we do have some solid theories. That brings us to the question, is ADHD genetic? Is ADHD genetic? Yes, at least to some degree. Scientists think that genes play a big role in the development of ADHD. Still, they have yet to pinpoint specific genes or gene variants that directly cause ADHD. They also think environmental factors play a role. What environmental factors are linked to ADHD? Some of the potential causes of ADHD have nothing to do with genetics. Some are environmental. These may include childhood exposure to toxins like lead, air pollution, and pesticides, nutritional deficiencies in utero, maternal substance use, maternal stress, premature birth, and low birth weight. What are the different types of ADHD? Some experts argue that there are more than 3 types of ADHD, but that's a topic for another video. For our purposes, there are 3 basic types of ADHD. There's predominantly inattentive ADHD. This is when most symptoms relate to problems with paying attention or focusing. There's also predominantly hyperactive impulsive ADHD. This type of ADHD features mostly hyperactive symptoms like fidgeting and high energy, as well as impulsive symptoms like interrupting someone when they're talking or trouble taking turns. And finally, there's combined ADHD. Now, I bet you can guess this one, and that's right. Combined ADHD just means you experience both categories of symptoms, inattentive and hyperactive impulsive. What are the symptoms of ADHD? Since there are different types of ADHD, a person's symptoms can vary greatly, depending on what type they have. Inattentive symptoms. Let's talk about inattentive symptoms first. These might include things like difficulty concentrating, frequently forgetting things, constantly misplacing items, trouble listening to others, losing track of conversations, being easily distracted, trouble organizing tasks or objects, procrastination, especially on difficult or tedious tasks, and trouble following through on projects you started. Hyperactive impulsive symptoms. Now for the hyperactive and impulsive symptoms associated with ADHD, these are the symptoms like fidgeting or squirming, trouble staying seated, feeling restless, being always on the go, a dislike for quiet activities like puzzles or reading, interrupting others' conversations, blurting out answers prematurely, trouble waiting your turn, or talking too much. Remember, people with the combined type of ADHD will experience both types of symptoms. Do you recognize some of the symptoms we just listed, perhaps in your child or even yourself? Let us know in the comments section and go ahead and subscribe and enable notifications while you're at it. We want to make sure you get the latest information on mental health disorders like ADHD. How is ADHD diagnosed? Recognizing symptoms is the first step to diagnosing ADHD, but it doesn't mean you or your child necessarily have the disorder. For a real diagnosis, you need to see a mental health care professional. Let's go over what to expect when you schedule an evaluation. First, there will likely be a comprehensive assessment. Your provider will want to assess both your physical and mental health overall. This is to rule out any other conditions that might be causing similar symptoms. There will also be a clinical interview. The clinician will ask you a series of questions designed to get you talking about your symptoms. They might take notes while you're talking. Finally, your provider will compare your symptoms to the ADHD criteria listed in the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5. The DSM-5 requires children to demonstrate 6 symptoms to qualify for a diagnosis, while adults only need 5. It's important to note that the diagnostic process for ADHD will also consider the severity of your symptoms. For example, mental health professionals recognize that everyone loses their keys sometimes. The question they'll ask is, does forgetfulness significantly disrupt your life at home, work, or school? Can you have ADHD and something else? Yes, this is sometimes called comorbidity, and it happens a lot with ADHD. Common comorbidities include anxiety disorders, mood disorders, substance use disorder, obsessive-compulsive disorder, conduct disorder, learning disorders, and Tourette's syndrome. If you or your child are diagnosed with another mental illness alongside ADHD, your provider will take this into consideration when creating your treatment plan. How is ADHD treated? The typical protocol for treating ADHD is a combination of medication and behavior therapy. Your treatment plan will be individualized, though, so it can vary. For example, children under the age of 6 aren't usually prescribed medication. And if there are comorbid conditions, these could play a role in the type of therapy you receive. Other treatments for ADHD might include parent training, organizational skills training, lifestyle changes like changes to diet, exercise, and sleep habits, learning coping strategies, and participating in online therapy. Fortunately, ADHD is one of the most treatable mental health conditions, and most people are able to manage their symptoms and get on with their lives. If you think you or your child has ADHD, it could be crucial to reach out for help sooner rather than later. Early intervention can lead to better outcomes. Looking for more information? Check out our video on navigating ADHD testing. I hope you've learned more about attention deficit hyperactivity disorder by watching this video. Make sure you subscribe to our channel to receive the latest updates on ADHD and other important information for your mental wellness. Thanks for watching.